in the places we go for healing, in the hands we trust with our lives, there exists an unspoken pact of safety and care. Hospitals are sanctuaries, and their staff are the guardians of our well-being. But what happens when that sanctuary is violated? What happens when a caregiver becomes a target in the most horrific way imaginable? Tonight, we delve into a case from Raleigh, North Carolina, a story that is not just about a crime, but about the weaponization of disease and a terrifying assault on the very people sworn to help us. The date was March 21, 2025. At the UNC Rex Hospital, a bustling center of medicine and hope, the emergency room was operating as it always does, a place of controlled chaos, where every second counts. Among the patients being treated was a 25-year-old man named Kameron Lamont Gilchrist. He was there for a diabetic issue, a common and manageable condition. The two hospital employees attending to him were professionals, going about their duties with the compassion and diligence their job demands. They had no reason to suspect that this routine medical call was about to descend into a biological nightmare. In a sudden, shocking act of violence, Gilchrist allegedly turned his own body into a weapon. The details are profoundly disturbing. Authorities report that he deliberately sprayed his own blood, which he knew to be HIV-positive, directly into the eyes of the two hospital workers. In that single, malicious moment, the fundamental trust between patient and caregiver was shattered. The act was not just a physical assault. It was a psychological and biological attack designed to inflict maximum fear and potential long-term harm. For the two hospital workers, the immediate aftermath was a blur of confusion, pain, and terror. Their eyes burned with irritation from the foreign substance, but that was the least of their worries. They were now faced with a potential exposure to the human immunodeficiency virus. The moments and hours that followed were filled with urgent, frightening procedures. They would have been rushed through decontamination protocols, their eyes flushed repeatedly. They would have immediately begun a course of post-exposure prophylaxis, or PEP, a demanding, month-long regimen of powerful antiretroviral drugs designed to prevent the virus from taking hold in the body. This treatment, while often effective, comes with a host of grueling side effects, including severe nausea, fatigue, and headaches. But the physical toll pales in comparison to the psychological torment. For weeks and months, these two dedicated healthcare professionals would live in a state of agonizing uncertainty. Every blood test, every doctor's visit would be fraught with anxiety. They would have to wait, suspended in a state of fear, to find out if a man they were trying to help had irrevocably altered the course of their lives. This incident is a stark reminder of the invisible dangers healthcare workers face every single day, dangers that go far beyond unruly patients or physical threats. This was a calculated assault, using a virus that has carried a heavy weight of fear and stigma for decades. One of the most perplexing questions in this case is the 6-month gap between the assault in March and the arrest of Kameron Gilchrist. The attack occurred on March 21 stet, but it wasn't until September 11, 2025 that he was taken into custody. While the exact reasons for the delay haven't been made public, we can speculate that a complex investigation was underway. Authorities would have needed to meticulously gather evidence, including medical records to confirm Gilchrist's HIV status and witness statements to build a solid case. The nature of the assault required careful handling by law enforcement and the district attorney's office to ensure the charges would stick. This passage of time, however, undoubtedly added to the distress of the victims, who were left waiting for justice while their alleged attacker remained free. Finally, on September 11, the wheels of justice began to turn. Kameron Lamont Gilchrist was arrested and charged with 2 felony counts of malicious assault on emergency personnel with a bodily fluid. This specific charge is crucial. It elevates the crime far beyond a simple assault. The law recognizes that emergency personnel, paramedics, nurses, doctors are in a uniquely vulnerable position and affords them special protection. The malicious aspect of the charge speaks to the intent behind the act, suggesting prosecutors believe this was a deliberate and hateful attack, not a random or accidental event. Gilchrist was booked into the Wake County Jail, where he is currently being held on a $25,000 bond. As the case proceeds through the legal system, it will raise difficult and important questions about justice, public health, and the safety of our frontline workers.